Respiratory cancer, otherwise known as lung cancer, is a non-communicable disease that brings suffering to many people around the world. About 80% of lung cancer deaths are caused by smoking, and many others are caused by exposure to secondhand smoke. What is respiratory cancer? Well, first off, cancer is a disease in which cells in the body grow out of control. Lung cancer in specific begins in the lungs and may be spread to lymph nodes or other organs in the body, such as the brain. Lung cancer is usually grouped in small cells and non-small cells. Why it should be addressed. Lung cancer is the leading cancer killer of both men and women in the United States, causing more deaths each year than colon, breast, and prostate cancers combined. Yet awareness of this fact is low, even though it is a very deadly disease with a low survival rate. And lung cancer does not have nearly the resources, support, and public empathy that many other diseases have. Symptoms. When an individual first contracts lung cancer, many symptoms begin to present themselves in smoking and radon exposure. Symptoms of lung cancer may include cough, often with blood, chest pain, wheezing, and weight loss. Progression of the disease. There are two different types of lung cancer staging, one of them being small cell lung cancer staging. At the limited stage, the cancer is found in one lung, sometimes including nearby lymph nodes. At the extensive stage, cancer is spread to the other lung, the fluid around the lung, the pleura, or to other organs in the body. Non-small cell lung cancer staging, occult stage. Cancer cells are found in sputum, but no tumor can be found in the lung by image tests or bronchoscopy, or the tumor is too small to be checked. Stage 0. Cancer at this stage is also known as carcinoma in situ. The cancer is tiny in size and has not spread into deeper lung tissues or outside the lungs. Stage 1. Cancer may be present in the underlying lung tissues, but the lymph nodes remain unaffected. Stage 2. The cancer may have spread to nearby lymph nodes or into the chest wall. Stage 3. The cancer is continuing to spread from the lungs to the lymph nodes or to nearby structures and organs such as the heart, trachea, and esophagus. Stage 4. The cancer has metastasized throughout the body and may now affect the liver, bones, and brain.
Cancer prevention is action taken to lower the chance of getting cancer. To prevent new cancers from starting, scientists look at risk factors and protective factors. Anything that increases your chance of developing cancer is called a cancer risk factor. Anything that decreases your chance of developing cancer is called a cancer protective factor. Different ways to prevent cancer are being studied, including changing lifestyle or eating habits, avoiding things known to cause cancer, taking medications to treat precancerous conditions, or to keep cancer from starting. Once lung cancer has been diagnosed, doctors will work to determine the extent of the cancer. The cancer stage helps the doctor decide what treatment is most appropriate. Some treatments include surgery, chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy. For surgery, more than 900 people undergo lung operations at Mayo Clinics every year. Chemotherapy uses drugs to kill cancer cells. Radiation therapy uses high-powered energy beams from sources such as X-rays and protons to kill cancer cells. Targeted drug treatments focuses on specific abnormalities present within cancer cells. And immunotherapy uses your immune system to fight cancer. Some health determinants include genetic, diet, social and cultural, and environmental. Smoking falls under the social and cultural health determinant. Smoking is the #1 risk factor for lung cancer. In the United States, cigarette smoking is linked to about 80 to 90% of lung cancer deaths. A geographic health determinant is radon. Radon is a natural occurring gas that comes from rocks and dirt and can get trapped in houses and buildings. It cannot be seen, tasted, or smelled. As you can see, lung cancer is a major concern worldwide. It is greatly affecting first world countries who have more access to tobacco like America. The country that is most affected by lung cancer is Hungary, from the cause of tobacco. Lung cancer is the most common cause of death from cancer worldwide. Tobacco smoking is the most important risk factor for lung cancer. Smoking interventions can be divided into two types of interventions that fall under the individual intervention. These two types of interventions are social intervention, which are methods that do not use medicines, such as advice or counseling, and pharmaceutical interventions, which includes medicines, such as nicotine patches. In conclusion, organizations and health workers are working together to lower the number of cases of lung cancer. It will be difficult to lower the number of cases, but with the help of donation and other organizations, it can be accomplished. A good way to raise awareness in this issue would be to advertise it on billboards and commercials. Together, we can accomplish this goal and lower the mortality rate by lung cancer.